Hi everybody and welcome to AARC's Big Ideas Theater. I'm your host, Ed Highland. Joining me now is Brooke Yeager. She's the speaker for Monday's session. Also saw you yesterday talking to the Patient Summit. Good to see you again. Building Bridges Across the Continuum of Care, New Models of Care. You got a long title, so you got a lot to live up to, Brooke.
Great.
Give us some idea of what it's all about. What are the most pressing issues, basically, facing the field of telemedicine?
Sure. So I think without question, the most pressing issue facing telemedicine right now is reimbursement. There are lots of people in our field who think that there are very important issues that we talk about all the time, ranging from things like the need for more rigorous research or continuum of care, protecting the medical home is very important, more widespread adoption for providers, and the need for guidelines and best practices. But none of those conversations will reach their full potential until we have intelligently written and comprehensive care policy written at the federal level.
Well, we'll talk about that in just a second. HR 2948, which of course is big right now. We want to talk a lot about the challenges. There's technical challenges as well as the legal and jurisdictional challenges, if you will.
Sure. And those do play a big part. Obviously, the federal challenges with legislation and legal issues are huge, and we hear about those all the time. But there's also a lot of state challenges. Every state is different. We're here in Texas, where Teladoc and the TMB are having a bit of a scuffle, if you will, and that really affects the way every state works on their parity laws. So every state has an individual parity law, and there were 15 when I started, like 3 years ago. Now there's 30 states that have them, and I would suggest that it's not always prudent to have a parity law just to have one. So, in our state of South Carolina, we do not actually have a parity law. We have it's called the Telemedicine Act, and it basically defines telemedicine so that we can legislate on our own how it best works within our state, because every state is different. Having said that, I would say that for telehealth and respiratory therapists, the most pressing concern and issue is making sure that we have a seat at the table when it comes to writing these policies. Because respiratory therapists span the continuum of care, right? We see patients from emergency medicine to critical care to diagnostics to disease management. That's really what we do. And the populations that we treat have two of the most prevalent and costly diseases, right? So COPD and asthma. So it is crucial that we are covered providers of telehealth.
AARC pushing very hard to get HR 2948 through the Congress. Always getting anything through Congress is always difficult.
Yes, it is. Yes.
Tell us a little bit about how you feel about it first, but also I guess the bigger picture, if you will. You've got things going. There's a Telemedicine Act, as you're mentioning, in just about every state. We know sometimes government, when they start getting into things, sometimes that can conflict with state rules. Do you see this 2948 as perhaps being a big equalizer of sorts?
I do in some ways. Politics is a game of incrementalism, as we know, right? Everything takes time. HR 2948 was introduced a couple of years ago by Congressman Harper from Mississippi, and he's a champion of telehealth. And there are a few congressmen that are really championing this. And we know that we are going to get some policy and some legislation on the books soon, but we don't know what that's going to be. And the problem is that the legislators really don't understand telehealth very well, right? So it comes to those of us who work in telehealth to provide that information and then try to help navigate and get that intelligently written policy in there and help them navigate, let them do the navigating actually of how we get something passed. The Medicare Telehealth Parity Act, I think is the most broad-reaching piece of legislation. There's 10 pieces of legislation that affect telehealth on the floor now. And they're just sort of all over the place, right? But I think that the Medicare Telehealth Parity Act might be the most broad-reaching, and it might make the most sense. And so, in a nutshell, and there's a lot of moving pieces to it, but in a nutshell, it does three things. So it would add respiratory therapists, and not just respiratory therapists, allied health professionals, so RT, OT, PT, speech pathology, those kinds of things, diabetes educators, as covered providers under Medicare, right? Obviously the most important part. It would also specify 3 diseases to be covered: COPD, CHF, and diabetes education. So these are our most costly diseases that we're treating right now. So that makes a lot of sense. And the third thing it would do, which is very important because it speaks to access to care, is that it would expand the number of people who are covered from the very most rural areas, which is what Medicare covers right now, that's the current legislation, all the way up to the biggest metropolitan statistical areas. That's really important because we know that there are healthcare deserts right in the middle of the biggest metropolitan centers. So that's really important, and it would be a phased thing. It would mandate research. So I think it kind of addresses all of the key issues. And I know that he and Senator Schatz from Hawaii, he has a bill out called Connect, and we also support Connect. But I work with Senator Schatz's Healthcare LA, and they have decided that they will include allied health professionals as well.
Interesting.
So
okay.
We're going to find a way in. We're going to get this done.
Exciting times for the field of telemedicine.
Very exciting.
Brooke Yeager, thank you so much. And since this is going online almost immediately, we can plug the Monday conference once again.
Okay.
Building bridges across the continuum of care, new models of care.
Yes.
Thank you so much for joining us in the Big Ideas Theater.
Thank you. Happy to be here.
I'm Ed Highland, and this is AARC TV.